The gonadotropin-releasing hormone pathway exerts different effects in males and females. In males, gonadotropin-releasing hormone, which is GnRH, is synthesized and secreted by the hypothalamus. Gonadotropin-releasing hormone then stimulates the anterior pituitary gland to synthesize and secrete follicle-stimulating hormone and luteinizing hormone, which are FSH and LH. Follicle-stimulating hormone and luteinizing hormone then stimulate the testes to synthesize and secrete testosterone. Testosterone has many effects, some of which include sex organ development and increased sex drive, muscle growth, and bone growth. In females, the pathway is similar except follicle-stimulating hormone and luteinizing hormone stimulate the ovaries to synthesize and secrete estrogen. Estrogen also has many effects, some of which include sex organ development and increased sex drive, breast size, and milk production. Also, notice how in both males and females, testosterone and estrogen, respectively, inhibit gonadotropin-releasing hormone and follicle-stimulating hormone and luteinizing hormone. This is an example of negative feedback. When enough testosterone and estrogen is synthesized, they inhibit gonadotropin-releasing hormone and follicle-stimulating hormone and luteinizing hormone so that testosterone and estrogen production slow down. The growth hormone-releasing hormone pathway begins in the hypothalamus. First, growth hormone-releasing hormone, which is GHRH, is synthesized and secreted by the hypothalamus. This stimulates the anterior pituitary gland to synthesize and secrete growth hormone, which is GH. Growth hormone increases muscle and bone growth and decreases body fat. Growth hormone inhibits growth hormone-releasing hormone via negative feedback. The thyroid-releasing hormone pathway begins in the hypothalamus. First, thyroid-releasing hormone, which is TRH, is synthesized and secreted by the hypothalamus. This stimulates the anterior pituitary gland to synthesize and secrete thyroid-stimulating hormone, which is TSH. Thyroid-stimulating hormone then stimulates the thyroid gland to synthesize and secrete thyroid hormone, which are T3 and T4. Thyroid hormone regulates internal body temperature, metabolism, and heart rate. Thyroid hormone inhibits thyroid-releasing hormone and thyroid-stimulating hormone via negative feedback. The corticotropic-releasing factor pathway begins in the hypothalamus. First, corticotropic-releasing factor, which is CRF, is synthesized and secreted by the hypothalamus. This stimulates the anterior pituitary gland to synthesize and secrete adrenocorticotropic hormone, which is a CTH. Adrenocorticotropic hormone then stimulates the adrenal glands to synthesize and secrete cortisol. Cortisol increases heart rate and blood glucose, and decreases digestion rate. Cortisol inhibits corticotropic releasing factor and adrenocorticotropic hormone via negative feedback.